All right, everybody. I think we're ready to get started here. Unlike a lot of our past webinars where we're focused on very specific medical content, we're shifting gears a little bit here and starting to look at how AI can be brought into the clinical practice. Without further ado, let's dive in. What are we going to cover today? First, we'll do some introductions. We've got Tom Cronin on the line, who will be representing Airia, which is our new sister company on the AI side. And we are grateful to have the expertise of Dr. Charlyn here with us today. He'll be sharing his expertise clinically and also how he's starting to bring a lot of the AI tools into his practice and how they're helping him in different ways. As usual on our webinars, we like to introduce some of the cool new products out there on the market. So we'll introduce some of the not technically sponsors. They're not paying us. We have no relationship with them. They're just cool stuff we want to educate you on. So we'll talk a bit about some of the cool new products that have come across our desk lately. Tom's going to take us through just a quick AI 101, just to make sure we're all on the same page here before we start getting into all kinds of acronyms and buzzwords and AI terminology that may or may not be new to some of us. So Tom will just get us all on the same page. And then we'll dive in. How do you start to actually bring these AI tools into your practice today? How do you get started? So we'll take you through a few of the important steps you need to think about as you embark on the journey. And then we'll have Dr. Charlyn share some of his expertise. And he's been very successful putting a lot of the AI tools into practice. So he'll give us some real world examples that you can relate to. As usual, we'll have plenty of time for Q&A throughout the webinar and also at the end. And we have our winners that we announce at the end of the webinar. So we've got our experts in the chat. So please feel free to ask all of your questions related to Heads Up, related to AI. If you've got questions about how AI works in a healthcare setting, maybe things you've been wondering about but didn't know who to ask or too shy to ask. So we've got experts in the chat that can answer any and all of your questions. So please don't hold back and fire away. I'll introduce our moderators here in a second. But we've got the chat room going. We always get really, really good engagement in the chat. We love getting all the questions. We love answering all the questions. And we rarely get to them all. So a new thing that we've been doing is after the webinar, we do a separate Q&A where we go through all the questions we didn't get to. And we'll send that along with the replay of this recording as well. So if we don't get to your question live, we'll get to it in the follow-up recording. So fire away and see if you can stump our experts in the chat. That's the best way to get a prize. So just a bit about me. I'm the founder CEO here at Heads Up. The mission at Heads Up has always been from day one to figure out how we can take all of the disconnected data points that relate to individual health, bring them into a single system, and then provide the clinical intelligence on top of that data to enable better treatment outcomes. We've been working on this problem for 10 years, gluing pipes together, building connections between disjointed systems, figuring out how to get data out of PDF files, sensors, electronic health record systems, spreadsheets, paper records. So that's been our mission from day one, is there's incredible clinical value in that data, but only if we can bring it together under one roof and then build the tools on top of it. And now we can unlock even more value from that data in clinical practice using AI. And we're excited to dive into that here today. If you're not familiar with Heads Up is the software platform that we've been building to synthesize all of this data. And we've spent a lot of time figuring out how to get all this data connected. How do we take data from different health systems and actually normalize it so we can put together the full history of an individual's health, How can we start to look at the performance of specific cohorts in a practice going through a specific program? How can we correlate different types of data sources? For example, how does blood pressure get affected by dysregulated sleep? So we've been building the user interface on top of all of this data, getting all of the pipes connected. That's what we've been doing at Heads Up. That's what we specialize in, is getting all the data organized, and now taking that one step further through our new AI capabilities, which we'll talk about here today. So that's me. That's Heads Up. I'll turn it over to Dr. Charlyn. Dr. Charlyn, please, and first of all, thank you. I know you're very busy in clinical practice, and we're grateful for your time on behalf of myself and everyone here at Heads Up. So thank you for giving us your time here today. Tell us a bit about your background, Dr. Charlyn, in clinical practice, and then a little bit about Charlyn Medical.
So thank you. And thank you for having me. This is such an important pivot point in everything that we're doing, the introduction of these AI tools. I've been a neurologist for 30 years, having gotten my medical training through Emory University in Atlanta, and then went on to do postgraduate training at the University of Virginia and Vanderbilt, primarily a little bit also at Emory and Wake Forest in North Carolina. And, I spent a number of years being a traditional neurologist, which, historically we've had very limited tools in our toolbox and earned a reputation of being able to diagnose conditions but have limited abilities to treat them. Fortunately, that's changed a lot. By 2025, I now own Charlyn Health Neurology. I've been in practice in this capacity for the past decade, and we've always, from day one, been focused on gathering data, tracking data, analyzing data, and really being able to not only bring a very specific personalized care to our patients and give them more options than they would ever have in any other traditional neurology clinic, but to be able to demonstrate the value of the outcomes that we do achieve. So this, whether it's Heads Up Health and now the integration of these AI tools into Heads Up Health, it's really very much in line with the mission and the vision of what I've been involved with for the past 10 years.
Awesome. Thank you, Dr. Charlyn. And we also have Tom Cronin with us today. Tom's with Airia. He's a product manager on their healthcare team. So Tom, thank you for making time today. It's been great working with you over the last few months, and it's very exciting to start to see Heads Up in Airia come together. You've been working with all kinds of healthcare organizations, large and small, over the last year or two, helping them understand the applications of AI in clinical practice. So thank you for joining, Tom. Tell us a bit about your background and tell us a bit about Airia and anything you want to share, just high level, before we dive in on
Sure.
some of the common use cases, questions, misconceptions about bringing AI into the world of healthcare.
Sure. Yeah, thanks, Dave. Appreciate the invite today. Hello, everyone. So I'm Tom Cronin, like Dave mentioned, one of the product managers with Airia. A little bit about myself, been in the healthcare agentic or healthcare realm for past 5-7 years with Deloitte in their healthcare and life sciences program. Was able to see healthcare organizations, large and small, all shapes and sizes. But over the past 2 years with Airia, we've really been able to find out these healthcare organizations' use cases and apply agentic AI and introduce AI into their current clinics or current systems. I think your second question of what would I educate folks about AI today is it is consumable for everyone. People sometimes get intimidated with the buzzwords and the new trends in the market, but when it comes down to it, anybody can use AI and improve their lives from a personal level, from a professional level, using all of the systems out there today. So
Cool.
at Airia, at Airia, we're a AI orchestration platform. We're trying to address one of the biggest challenges with facing companies today with AI adoption. So we provide a very easy way for organizations to bring in their existing data, bring in their existing systems, and scale with AI or layer in AI to their existing systems in a secure, manageable fashion.
Awesome. Thanks, Tom. And we've got lots of good examples of how to do that as we go through the rest of the presentation here today. I mentioned some of our moderators that are answering questions in the chat. We have Olivia and Nikhil. They're the experts from Airia. So any of your burning questions on how to get started with AI, anything specific to healthcare with AI, they're here to answer any questions you have on that side of things. And then we have Kevin and Tara. They're from Heads Up. They'll be able to answer any questions about the Heads Up platform. So fire away, keep them busy. They're here just to help you with any questions that we can answer on these topics. So for those who are not aware, Heads Up has recently undergone an acquisition. And through that acquisition, our sister company is now Airia. And this is very exciting for me as the founder of Heads Up, because this is truly the next level in our ability to unlock more value from all of the data out there. Yes, we still need traditional tools. We still need EHR systems. We still need longitudinal trend lines. We still need PDF files. We still need traditional data analysis tools. None of that stuff goes away. We still need our systems of record, just to be very clear about all of that. But the next step is, how do we now add AI onto those systems so that we can start to have a much easier way to interact with them? So we can start to use AI to help us with data analysis, with diagnostic opinion, with identifying insights in the data. It's just the next level of growth in terms of how we think about what's possible within the practice. So I'm excited to show you examples of ways that we can help with automating very tedious clinical workflows. Dr. Charlyn's going to share examples of how he's taken some of the workflows that would have taken him hours to do, and how we can shrink that down into something that takes minutes. We're going to show how we can start to finally unlock value from this wearable data. Yes, Heads Up has been able to build reports and charts and graphs and all of those things, but it's still very time consuming with a lot of cognitive load to consistently every single day just get a quick summary of the signals that you're looking for inside the data. So I'm excited to bring this into the next chapter of Heads Up. And like I said, we still need all of the traditional tools and systems. With AI, we can just start to unlock a lot more value from them. I mentioned some of the prizes we'll be giving away today. They're not technically sponsors. I think we need to change this for future webinars. Just to be clear, we don't have any financial arrangement with any of these companies. They just make awesome products. So at the end of the webinar, we'll be raffling off an Oura Ring. In our humble opinion, the gold standard out there in monitoring patient health between the visits. And it provides incredibly valuable data on sleep, activity levels, physical recovery, body temperature, women's cycle data, resting heart rate. There's just a ton of clinical value in the Oura Ring. Dr. Charlyn uses it in practice. Many of our customers use it in practice. And it's also important for the clinicians who are out there every single day trying to make sure that they're staying at the top of their game. They're getting the rest and recovery that they need as well. So it helps us self-calibrate to make sure that we're eating our own dog food, so to speak, and we're getting the rest and recovery we need to show up as the best version of ourselves every single day. So we'll give away an Oura Ring. Age Rate, this is a company up in Canada. They're making a methylation-based biological age test. So with a drop of blood, they can do a very, very detailed analysis and provide a lot of the information on biological age, immune health, inflammation, other markers that you can get from DNA methylation, biological age testing. So we'll be giving away one of their kits. I think they retail for about $450. Kinetic, I brought this company on because I discovered them a couple weeks ago at a conference I was at on, it happened to be on long COVID, but they've actually made a exogenous ketone product specifically tailored for clinical use. And what they've found is that in clinical use, you often need to get to much higher doses during the day, sometimes 20 grams per day, 40 grams per day, or more. So they've made it affordable, and they've made the bottles in a size that allows you to get much, much higher doses of clinical grade ketones. They've also been very careful about the ingredients that they put in there. So there is nothing that will be counterproductive to people with sensitive immune systems, food allergies, anything clinical. So it's just a really interesting clinical product in the world of exogenous ketones, which I take every day just for performance. I slammed a bottle before the webinar, but Kinetic is taking a clinical approach to exogenous ketones, and just a cool company on our radar to take a look at. So we've got a giveaway from them. And last but not least is this Cacao superfood, which is full of powerful antioxidants like theobromine and others. I met the founder of this company recently. She is of Peruvian nationality and origin. She's sourcing all the cacao from her home country. She's doing all of the third-party testing to ensure there's no heavy metals in the cacao. It's just delicious and amazing, and a great way in the afternoon just to get a alternative to a second cup of coffee, but just really clean, delicious, high quality cacao. So we've got some of those on the giveaway as well. So best way to win the prize is pepper us in the chat with questions. Our team is monitoring. We'll announce these at the end. So just some cool products to put on your radar screen that we love. So getting into the meat and potatoes here, Tom. So lots of buzzwords out there, lots of hype. I think it's important we just set the table on some of the terminology that we're going to use throughout the webinar so that we don't lose anybody. There's Claude and Gemini and ChatGPT and large language model and generative AI, and there's all these terms out there. Some of us have more understanding of those terms than others. So would you mind, Tom, just taking a few minutes to get everybody on the same page here with the terminology before we go forward?
Yeah, absolutely, Dave. So there are many different flavors of AI. What we're specifically speaking about today is generative AI. On the right of the screen, you see a couple logos here I'm sure many folks are familiar with. It's your Chat GPTs, your Anthropic Claudes, Gemini, Copilot, Meta's Llama models. So all of these different model providers have a collection of models which are LLMs, large language models. And these are essentially the AI models trained on different data sets, some large, some small, some quick, some more complex. From there, you have prompts. Prompts are nothing more than the instructions that you give a model or an LLM to execute on. Give me a nice itinerary for my Cabo vacation, or maybe something more clinical focused of trend out a patient's biometrics over the past week or two. Then you have tools. Tools allow you attach a tool to an LLM and you can retrieve data from a database. You can do web search, you can do calculations. So tools, think about a tool belt on an LLM. These LLMs can access these tools if it's not within their trained data set. Then you have RAG, very fancy word for essentially citations. So you can take your proprietary papers or maybe some studies, attach it to a model, and this model can first reference all of your information and RAG it back to you. So you'll be able to search trusted documents first and then go to the data set it was trained on. And then lastly, guardrails. Guardrails are the safety precautions or safety mechanisms and controls you put into or onto your AI to ensure proper behavior, access to the appropriate information, lots of different redaction, blocking based on your prompts, things like that. All of this combined is what we call agents. So agents are they can be augmented work, they can be autonomous work, but it's strapping these different components onto what we're going to just broadly classify as AI to allow you to build different workflows, planning tools, so on and so forth. We'll get into later in this discussion.
Yep. Thanks, Tom. Very helpful. And again, we've got specific examples of this in practice that Dr. Charlyn will share that kind of take these terms and put them into real world application, but just some of the more common terminology out there, what it means. This is just a quick intro. We'll get into more specifics as we go. So thank you, Tom. So we just wanted to check in with you guys. I think it's interesting to see how AI is being used today in your practice. So I'm going to launch the first poll here, and we'd love to hear from you. So are you using any AI tools in clinical practice today? Yes or no? And then whether you are or you aren't, we're just interested in what types of use cases are most interesting to you. Where do you think AI can be helpful in practice in terms of automating workflows, helping with diagnostic assistance, summarizing patient reports, SOAP notes, generating treatment plans. So this is just helpful for us to figure out what kinds of use cases you're most interested in, and then we can tailor some additional content over the next several webinars to address some of the interesting use cases here that you've identified. So I'm going to leave this up here for another minute or two, and I'll shift slides here and get into the rest of the presentation, which is how do I actually get started? And we've got a quick process that we've identified, but before we get into the how, I wanted to give you a couple examples of AI in healthcare today. And the point of these examples is just to show you what's possible and to show you how some of these very successful AI platforms have just seen incredibly rapid adoption in the industry. And the first one to look at is a platform called Open Evidence. And Open Evidence is a clinical decision support system. Simply put, it's a tool out there to help you with decision making in clinical practice. In some cases, it's very high stakes clinical decision support, where life or death questions inside traditional healthcare are being asked about interactions between certain conditions and medications. And so it's seen incredible adoption. And Open Evidence launched 18 months ago, and they've got 40% of the US doctors on the platform already, 65,000 new doctors per month. By the way, this is a tool that's only available to providers. So you can't even register for Open Evidence without an NPI number. So they've made a strategic choice as a company to make this a clinician-only AI tool. So it's built from the ground up specifically for clinical questions. They have content partnerships with the New England Journal of Medicine and JAMA, which means they have essentially 35 million peer-reviewed publications that have been effectively indexed by the AI system. What they're really, really good at doing is allowing you to punch in a case report, a whole paragraph. I have a 58-year-old female with a history of multiple sclerosis. They're experiencing severe symptoms of psoriasis. I need to find a treatment plan that will work for this individual. I want to see exact peer-reviewed studies. And you can just punch that whole paragraph of text in, much more than you'd punch into Google, for example. And Open Evidence can recognize that whole paragraph and not just look at the keywords. It can really look at the whole semantic meaning of the case report as a whole. And then it can point you right down to the top 2 or 3 peer-reviewed papers, right down to the exact page, even the copy and the footnotes on each page. It can point you to exactly where in the paper you'll find the answer to your question. So it's just seen incredible adoption. It's apparently scored 100% on all 3 phases of the U.S. medical licensing exam, which, according to my research, no human has been able to do. So the other interesting thing about Open Evidence, I listened to a podcast with their founder recently. He said in 1950, if you go back to 1950, the rate at which the number of peer-reviewed papers in the world was doubling was 50 years. So basically from 1950, it'd take 50 years and the number of papers doubled. At this point, it's every 73 days. So it's effectively an impossible amount of information to keep up on. And what this tool does is just allow you to have access to all of it in a single search. It's incredibly accurate. It's got all of the top content partnerships in there. So again, this is just an AI tool that is changing the game in terms of how we find peer-reviewed papers relative to our clinical cases. This one is interesting. This is a Microsoft tool. They basically took all of the common large language models that you hear out there. Oh, let me stop the poll here before I forget. Yeah, I think it's done. So this one, what was interesting about the diagnostic orchestrator was they basically took the 350, I believe, hardest cases in the New England Journal of Medicine, and they fed them into the diagnostic orchestrator. And they basically turned the diagnostic orchestrator into a very precise sequential diagnostic tool. So they fed these hard cases in, and they said, act as a clinical team. It was effectively a clinical team that they've built. They loaded the questions in from the New England Journal of Medicine and trained it to go through a diagnostic process. And just like a human doctor, the LLM could ask questions. For example, is there a family history of X or Y? It could also order labs. So as part of the diagnostic process, it could say, okay, I now want to see results of a CBC panel. And it would go through another diagnostic iteration, and then it might request an imaging test, for example. It was also keeping track of the cost of every test it was asking for. So the AI tool couldn't just ask it to run every test known to man. It was specifically also trying to minimize cost. And this was able to accurately diagnose the hardest cases at an 85% success rate, about 4x what their human benchmark team could do. Not a direct comparison. There were limitations in how they compared it to the human team. For example, the human team wasn't allowed to use AI tools. But nonetheless, the success rate was exceptional with some of these really challenging cases. Again, these are tools that are becoming available to clinical practice. And what I'm even more excited about is not only can these tools have access to all of the medical information that they're trained on, but what if we could now connect them to all the data on the patient record as well? That's sitting inside Dr. Charlyn's EHR. So these tools did not have access to any of the patient history. It was just doing a net new diagnostic process. So I think there's opportunities to take these tools even further in clinical practice. So just a couple examples of how these tools can change the game. So how do you get started? Here's a few simple steps to think about that I'm going to walk through. First, starting with security and compliance, getting the data connected, getting the EHR connected to AI in a secure manner. Learning how to prompt AI. Yes, you can log in and just type in a one-word question, but there's a specific art form for getting AI to give you exactly what you want. A lot of it is determined by how you ask the question. And there's a skill set involved in asking questions in the right way. So we'll talk about that. Prompt engineering is often the term that's used there. And then we'll get into specific examples of automating entire workflows. Tom talked about how all of these tools come together into agents that can do things on a continuous and repetitive basis for us. And then just some easy ways to start small. This doesn't have to be complicated. Tom also made that point. There's easy ways to get started. So first and foremost is starting with security and compliance. And what we don't want to do is start taking information that is protected under HIPAA or has PHI in it and putting it into public models. So we want to make sure that any platform that you choose to use for AI is HIPAA compliant, that you have a business associate agreement in place with the providers you're working with on the A side. The ARIA platform is fully HIPAA compliant. The ARIA platform is also ISO and SOC 2 compliant. And the Airia platform also has agreements in place with all of the AI companies that none of the information put in will be used for training purposes in their models. So it's just important to have that in mind. Yes, you can log into an LLM and ask a simple medical question with no patient information in there. But if you want to upload a lab report from someone and ask for an analysis, that starts to cross over into the realm where we want to make sure everything we're doing is secure and HIPAA protected. So just keep that in mind as you're going on the journey, and make sure that you're selecting vendors you work with that can meet these important requirements. Tom, anything you want to add on the security and compliance side that I missed?
Yeah, absolutely. So if we could talk about this all day, Dave. But at Area, we really try to level in redundancies on top of redundancies when it comes to our security framework and our security posture. You called out a couple key ones as well. Your role-based access, provisioning access to only the people that need to see the information. We could go on and on, but lots of mechanisms, and we've done a couple audits now to ensure that we're following everything in all best practices.
Awesome. Thank you. Okay, so you've got a HIPAA compliant partner or software vendor that you've chosen to work with. The next step is, how do we actually start to get the patient record connected to AI? I mentioned before, AI has all of this incredible information on it. It's very easy to interact with. It's very easy to prompt. And it gets even more powerful when it's connected directly to the patient record. How do we do that? So where is all of the patient data today? Lots of it sitting in the EHR. Sometimes it's sitting inside PDF files inside of the EHR. So can we connect to the electronic health record system? Can we actually use AI to get the data out of the PDF files and securely store that information so that it can be part of the AI process? A lot of the practices we work with are using DEXA and in-body machines. A lot of the practices are bringing wearables into the environment. Sometimes we're running very, very sophisticated and complicated genetic tests, microbiome, urine, stool. There's just tons of biometric data out there, and we want to get that connected to the platform so that we can include that in part of the prompting and part of the agents we build, and include it as part of the analysis that we can have AI help us with. Also, Dr. Charlyn's going to talk on his slides about how he's taken some of his proprietary content. He's got his own book that he's written. He's got very, very specific supplements that he uses with specific doses for very specific purposes. So that's not data, but that's very specific internal content that Dr. Charlyn has developed over decades of experience in neurology. And can we have that data attached to the large language models so that it can be included in the process? So that's what we do at Heads Up. That's our specialty. And our existing customers know that. What we've been working on for the last 10 years is getting all of this data connected into one system. And if you're working with us, you know that we can pull in the PDFs, pull in the labs, pull in the wearables, pull in the assessments, pull in photo video. All of the data gets centralized under one roof, and then we can build the AI use cases on top of it. That's where I think Heads Up and Airia really have a beautiful partnership, is leveraging everything we've done in terms of plumbing, basically, and then putting the AI layer on top of it. And that's when we really start to get the best of both worlds. So as you're thinking about how you want to move forward in practice with AI, start to think about, how do you bring all of this extremely valuable data into the conversation? Tom, Dr.
Yeah,
Charlyn, anything you want to add here?
Dave, I'm a fan of wearables. I got the continuous glucose monitor, the
Right
Aura
on.
Whoop.
Yeah.
So, I mean, the more data, the better, right? Pulling in the data, chatting with this data, and really LLMs come down to pattern recognition. They're incredible pattern recognition machines or systems, and they can really find that needle in the haystack of, why is my glucose spiking, or why is something happening, right? So that's what I use it for on a personal use case.
Awesome. And there's other common use cases. A lot of the ones we get are, can you take my specific protocols, my specific reference ranges, my specific treatment plans, analyze this lab work from a given patient, and recommend a treatment plan for me? Dr. Charlene, I know you're going to talk about that on your section, but anything you want to add just in terms of AI plus data and where you see the opportunity there?
Well, I think the opportunities are truly endless. And, you know, I come to this, you know, hopefully with some degree of expertise, but I want to be clear that I'm not a formal expert. I don't have, you know, certification training. I'm not in, you know, Tom's area, for example. But I think that's a strength in me, hopefully being here, is that it's just a love of technology and data, and you know, willingness to be inquisitive and try things and explore things. And I think many of us are in that same boat, in the sense that there's so much excitement over AI that we're in this explosive exponential phase of people creating all kinds of tools that are often built on things like chat and built on Claude or built on Gemini and so forth. And ultimately, I think, you know, the things will settle down and there will be some clear winners, and unfortunately there will be some clear losers. But it can be quite overwhelming now. And I can say I've not spent a lot of money, but I've certainly spent some money on subscribing to some platforms that I thought would be useful and weren't in the end. And I think that's okay. And I would kind of encourage folks to take the same chances and just explore really what are limitless possibilities. It's really our imagination as human beings that limits what AI can do for us. It's not going to, you know, we can talk about AI agents, but for the most part, the AI that we're going to be engaging in is a result of our own creativity and asking that AI to take on certain tasks for us.
Well said. Thank you, Dr. Charlene. So the next one I want to talk about is prompting AI. And you can think about prompting as how do I ask the right questions from AI to get the right answers? I have this cheesy graphic on here, but there was this Star Trek episode where Scotty and the Star Trek team come down to Earth. This must have been in the 80s or 90s, judging by the computer. And Scotty is thinking he can just pick up the mouse and bark commands at the computer like he does on the ship. Obviously, at that time in our history and our technological advancement, that didn't work. But it does now. And we're now in an era where you can have a very conversational interaction with AI, and you can have a very natural conversation around the data in your practice. So it becomes very easy to interact with these systems. You know, at Heads Up, we've been building a lot of these data analysis tools for years. And a clinic like Dr. Charlene would come to us and he'd say, these are the programs I run. These are the things that I measure as success in my practice. Can you build me the reports to help me track these metrics across all my patients? And yeah, we'd go away for 2 weeks and code it all up and build it and review it and go through a few more rounds of changes. And we still do that, but now that same process can be done in seconds with a simple natural language question. So for clinicians out there, you may have a lot of hypotheses about things that are in the patient data, but you haven't had the tools to analyze those properly. It'd be too complicated to go build it. You may have speculative questions. Show me which of my patients have high blood pressure and have very poor sleep scores on the Oura Ring. Well, that's a speculative question that you could ask that would be hard for us to code before. And you might get something back and you might not. But it starts to be very easy to explore data, to ask for hypotheses, to ask for second opinions, to ask for data to be formatted and presented to you in a certain way. It all becomes very self-service in terms of how you interact with the knowledge in the LLM and how you ask the LLM to interact with the data in practice. And there's a bit of an art form to it because there's a lot of information trained in these models. So if you ask a very general question, you're going to get a very general answer. If you learn how to build a very specific prompt, you can get a very specific answer. So that becomes the art and science of how you ask the questions. But the point is that we now have very easy ways to interact with these systems. And let's get into a few examples here. Dr. Charlyn, you feel free to chime in, but simple ones like, for example, give me a concise summary of all the patients on my calendar today, include the date of their last labs, keep it in this format, and run this for me automatically every single day at 8 a.m. so it's in my inbox. But this is an example of a short prompt that can very quickly summarize information about the patients on the calendar today, and you can be very specific about how you want the output formatted. What
Along
information you
those
want
lines,
included.
something that our nurses do for me, my nurses do for me, but if you're a clinician and you have, a brick and mortar practice, you probably do the same thing, and we call it chart prep, right? And it's a lot of work. When I'm a paper guy, believe it or not, and even though we obviously have electronic health record, but I like to have things in my hands. But nevertheless, what I'm saying is you could say, okay, I've got these, 20 patients coming in today. Of the 20, the AI will know a certain number of them are return patients, some of them are new. But on those return patients, by and large, some of them may have had some diagnostic tests ordered. We need the results available all in front of me. So when I walk into the room, I've got that MRI report, I've got the, blood work. And not only can the AI put all that together without my nurses needing to do that manually, but we can ask the AI to summarize that data. Were there pertinent findings? Are there action steps? Is there anything, no pun intended, that I should have a heads up about? Right? Hey, did you notice the radiologist commented on this lesion on their MRI? So I don't miss it, right? And potentially it could suggest action steps beyond that. What am I going to do with the patient based on this data? Am I going to order additional tests? Am I going to recommend a treatment? It can do all that. And then it's, of course, up to me to decide if that really makes sense and that's what I want to do. But we can go very far with this.
Yeah, and I echo that point, Dr. Charlin. We're really going down this industry of personalized software where you operate your day in a certain schedule, and another clinician might like to see their patients or different workflows in a different way. So use cases like this we see often where you're able to customize your experience or your software for your day.
So this is another one that I think is interesting. This one came up on a webinar we did last month with Dr. Leonard Pastrana, and we were talking about some of the key biomarkers of longevity. And we talked about ApoB as a biomarker of cardiovascular risk disease. And this is a simple data analysis question. Find all the patients who have seen the highest rate of increase on their last 3 ApoB tests and show me that as a percentage in a table sorted from highest to lowest. If you've looked at a typical lab report, they may or may not have the previous ApoB ratings on that report. And they definitely do not necessarily show the percent increase from test to test. That's something you'd have to calculate. Sometimes the patient's been to 2 or 3 different labs, and so the ApoB readings are all over the place. But we can ask a very simple data analysis question. Go through every patient in the system, find all the ones that have had 2 or more ApoB readings, calculate the percent change from test to test, and show me the ones that are experiencing the highest rate of increase sorted from highest to lowest. So could we build a report to do this traditionally? Yes, we could. It would probably take us a few hours to code this, and it might not be exactly the way you want. So we'd go through a few iterations, and we do a lot of that work. But this is a simple plain English statement. And this could have been a completely speculative question where you may not even have bothered of asking the IT team to build it for you. But a simple question that would be, I don't know, Tom, a few hundred lines of SQL code to actually go do this and format it exactly the way you want.
Yeah.
That gets handled in seconds. So, Dr. Charlene, any examples of just like speculative data questions on this one that come to mind for you that you might not have asked before because you didn't know how to format it or analyze it or crunch it, or it just wouldn't be worth your time, where you can just maybe ask some exploratory questions about biomarker data?
I mean, there's certainly all kinds of questions that we could definitely ask about biomarker data, and some of these biological markers, when we're, boots on the ground, are going to be sort of very black and white, very obvious, and we don't necessarily need AI. I think in particular, we're analyzing subtle trends or statistical data that really kind of have to be seen by a set of eyes that really goes beyond what human eyes do, if you will. I actually want to use an example that is more utilized by my wife, Valerie, who's a health coach. She is a certified heart math practitioner that primarily relies on heart rate variability data and all the statistics that can be, run on raw heart rate variability data. And it's quite complicated statistics. And she's been able to amass a large amount of HRV data on populations that we see for which in the peer-reviewed literature, there's actually very, very, very little. And I've told her she does not come from an academic background. She is a board certified coach and it's a background in gerontology. However, being able to pull together this very unique data and then look at it from the perspective of multiple sclerosis, Parkinson's disease, ALS, Alzheimer's disease, really can't happen without the help of the AI. And then ultimately it becomes not only in the more abstract sense, presentable data or publishable data, but really more importantly, it allows us to take action steps with our patients because we can understand better how heart rate variability changes influence the trajectory, for example, of Parkinson's disease.
Awesome. Yeah. So she may be analyzing hundreds of thousands of data points. And as a person who's not trained in statistics or data analysis or even presenting this information, she actually can just use a natural conversational interaction with that data to get exactly what she wants. Obviously, then cross-reference it back with source data, and then even ask questions about how the data pertains to specific disease conditions. Is that correct? Awesome. So I mentioned this one before, but asking for recommendations. You and I talked about this, Dr. Charlene. Hey, I've got a patient with MS and psoriasis, and I've come up with my recommended treatment plan, but can you recommend something that I may not have thought of before? Or can you find any peer-reviewed publications that look at certain drug interactions for people with MS and psoriasis? So Dr. Charlene, this is more of an example where you might be asking AI to give you a recommendation, either as a second opinion or maybe to propose a few things that you hadn't considered before. So like hypothesis generation, anything you want to speak to there?
Yeah, I found it very helpful for this. I would also call it my check my thinking, tool. Every once in a while, I'll see a case that's unusual, it's different, and I fortunately I should say that right now the AI that I am using is not directly connected into my EHR. I do not upload private health information into the AI tools that I use, such as Chat, Claude, Gemini, primarily those three, a little bit Copilot. But what I can do is strip out that patient identifying information and put it in my subscription-based AI, meaning that I don't just use the free versions of these, I do pay for them. But with these complicated cases, I can essentially present the history, my pertinent findings on examination, any lab findings that may be relevant. Of course, to be clear, you do not upload a PDF with all the patient identifying information. This may have to be manually, cut and paste into the area where the prompt is. But in the end, it can help me sort through some different ideas, Oh, I hadn't thought of that. That's a good idea. That's not a good idea. It doesn't make sense. For example, I have a patient that I saw recently. I don't know if it's all that complicated. Unfortunately, he had been a long-standing alcoholic, very nice gentleman, a veteran, not uncommon among veterans, has developed a severe peripheral neuropathy. Alcohol is a neurotoxin, but he's been sober for several years. He is not diabetic. He does not have kidney failure. And he said, this neuropathy really has evolved since I became sober. Now, I did a nerve conduction test. Of course, I did the whole history physical exam. He has severe neuropathy, so bad that he lives about 30 miles from where my clinic is. He has to take an Uber everywhere because he can't feel his feet to drive. Now, is alcohol-induced neuropathy a possible explanation? Of course it is. And I said to him, look, you may not have realized how bad this was getting until you sobered up. And that's just being real. But I used the AI to say, what else should I be thinking about? I've already checked the boxes of the common causes. For those of us who practice neurology, there's kind of a standard set of labs that are always done when people present with a degenerative neuropathy or an inflammatory neuropathy. But then there are also the less common causes. And, I didn't necessarily agree with everything that was recommended when I put all this data in, but there was a handful of things that made a lot of sense. They were easy. It was just a lab. I knew they were covered by insurance. I could order those labs, and it augmented my human thinking and my own, steering. I'm the guy at the steering wheel. I think maybe one of the fears or one of the concerns about AI is this so automated that we remove our own autonomy over the practice of medicine and the care of the patient. And I think in some cases, there definitely are things that can be automated, and that's where the agents come in. But I think overall, it's not a fear that we should have because, again, you can go to Home Depot and buy all kinds of tools, but those tools are not going to build your house for you. You're going to build the house.
Yeah, augmentation, Dr. Charlyn, I think is the perfect term to use there. Just some other simple examples that we come up with. Give me a simple low-tech explanation of a specific medication I can email to a patient and list out some of the side effects. So we do this all the time, but just saving you the cognitive load of writing an email explanation for a specific patient in related to a specific condition. Again, just simple little time-saving things that can make life easier. Again, to Dr. Charlyn's point, maybe it'll get you 90% of the way there on the copy, and you've got to do the last 10%. But explaining complex medical terms in simple, patient-friendly types of output, just simple ways you can interact with the system to save time, make things easier. This is one we worked with one of our customers up in the Bay Area a couple weeks ago. They use an EHR, and they put all the medications and supplements and peptides into the EHR, and it spits out this PDF that's just extremely hard for patients to read and understand. When do I take these medications? What time? What day? The output of the EHR is too complicated for these patients. And so we built an agent that takes the PDF from the EHR and makes a simple infographic for the patient that makes it simple for them to understand what to take and when. And with a little bit of tuning, again, this is a repetitive task where we'll train an agent to do this. And now we've taken a very complicated, clunky, hard to understand PDF and worked with a practice to make something that is simple and easy and digestible for patients that they can just tape on the fridge and have a much easier experience managing their complex medication schedule. So simple stuff we can do that actually can have a big impact. Moving right along, I want to shift gears. So we talked a lot about prompts. Prompts are just these questions you can ask, speculative questions, one-off questions, summarize something, analyze something, write an email. But inevitably, you're going to get to the point in clinical practice where you're going to want AI to start doing these tasks on a repetitive basis. So, for example, maybe you have those medication treatment plans for every single patient. And instead of just doing it for one patient, you want that done for everybody. And you want the infographic to be set up a specific way. You want your company's logo on there. You want some disclaimer copy on the bottom. You want it formatted in a certain way. That's where we then see ways to automate that with agents. And that's the difference between just a one-off prompt and something we're going to do over and over again. And when you're in practice and you think of a workflow where you're like, hey, I've got to do this over and over again, that's the term we use is we want to build an agent to do that. So what are some examples? Well, we use agents to get data out of PDF files. And we've trained the agent to recognize the PDF file. If you see a PDF file from Quest or LabCorp or Dutch or Genova or Great Plains, they're all formatted differently. They all have data in different places. We have agents that know how to recognize those documents and get the data out. We work with lots of clinics who commonly write treatment plans based on their very specific protocols, their specific reference ranges, the type of practice they run. And we're able to help automate the creation of the treatment plan. Again, to Dr. Charlyn's point, it's an augmentation. They'll get the treatment plan 90% of the way there. We talked about how we can build agents to analyze wearable data, personalized protocols as new data comes in. There's all kinds of things we can automate in the practice that can be very effective. So let's look at a few specific examples here. Dr. Charlyn, this is one you and I have been cooking up here, along with some of our other customers, but I've got hundreds of patients with Oura Ring connected. And in your case, Dr. Charlyn, Valerie's analyzing the HRV data for all of the patients. And every single day, she just needs a summary to identify certain patterns that are relevant for her. So we can build an agent to look for those patterns every single day, the exact patterns in the data that you want to look for. Hey, every morning, tell me any patient who's gone down plus or minus HRV 5% from baseline or 10% from baseline. Or maybe it's not every day. Maybe it's just their weekly average. Or identify outliers in the data. So these are agents that can run continuously in the background. Yes, we can do this in Heads Up today, and we do that with our traditional tools today. But this allows us to make it much more personalized for your practice, much easier just to get a summary in your inbox every morning, or at least a link to log into the system and review it in a HIPAA-compliant way. But we can have agents that analyze wearable data or CGM data and flag patterns. We can have agents that build protocols for you. So, Dr. Charlyn, you have an incredible example where you've taken some of your specific content, your book specifically, on how you treat. You've taken your specific supplement line with the ingredients and the doses that you've developed. You've basically built an agent to automate the generation of these protocols, which has been very helpful time saver. So I'd like to turn it over to you to give us a specific example of how you've taken something very specific to your practice that you've perfected over decades of clinical practice and were previously doing it manually. And now you can automate a lot of that work. So can you take us through this example here?
Yes, and I want to say about the previous point, if it's okay. I think we get to the point where these agents are identifying certain patterns, and then you're suggesting that maybe, at that point, as coaches, physicians, what have you, dietitian, fitness expert, depending on the parameters we're looking at, we grab the wheel and we say, okay, once we see all the folks who have certain specific changes that the agent has identified, they bring them to our attention. But I would go further than that and say, ultimately, when we see those patterns or those changes, we as providers or clinicians or coaches, we ultimately do protocolize, if that's even a word, our response to those changes in patterns and what we're going to do with it. Well, we can teach those agents to do that too, right? So, because if you have 500, 1,000, 2,000, 5,000 people wearing Oura rings that are in your EHR database, there is no way that you're going to be able to reach out to them individually when you see certain patterns. So ultimately being able to train the agents to say, when I see this, I want you to do this. And then to your point on the previous slide, you can create all kinds of things to bring this to the patient's attention, to educate them, to inform them, to motivate them. We talked yesterday about using specific kinds of language that really kind of gets to us as human beings psychologically, that neurolinguistic programming, because it's so important when it comes to the style of medicine that asks people to make changes in behavior to improve their health outcomes or their disease outcomes. So in my practice, I do have kind of a hybrid practice. I am a certified functional medicine practitioner, and I utilize the principles of functional medicine taught to me through IFM, Institute for Functional Medicine, to help patients with neurological conditions like Alzheimer's, Parkinson's, MS, and so forth. There's a very specific framework that is taught to practitioners. It is in the language of IFM. It's called the timeline and matrix, and within that is a type of medical history. It's really it's your biography from when you were born, and details about your parents and your siblings and where you grew up, because all of those things play a role. In the language of functional medicine, some of these things are called antecedents, triggers, and mediators that help us to understand the things that led up to the tipping point, the diagnosis, maybe that's Alzheimer's disease, and then asking the question, what is keeping the person on this current trajectory of Alzheimer's? Because in my world, this is a disease where there is fertile opportunity to change the trajectory. I have patients that come in with biomarker confirmed Alzheimer's, and when they're done working with me, they do not meet the biomarker definition of Alzheimer's disease anymore. But we have to be able to identify that, and it can be done manually, but the ability to take the timeline that I have collected, sitting in front of the patient, listening. And you can ultimately, I think this will be very doable on the iPhone. There are already, AI scribes out there. But to collect that history that's unique to functional medicine, to layer in the traditional medical history. When did you first start to notice a change? How did it progress? What makes it better? What makes it worse? Have you had any tests done? The usual things we ask as traditional providers. And then ultimately dump that data into the AI that I have taught. Again, I've uploaded my book. I have a couple books. But it gives the AI the framework. This is how Dr. Charlyn thinks. This is what he's looking for. And to go ahead and kind of rework my raw data collection and organize it into those antecedents, triggers, mediators, put it into what we call the systems biology framework, so that people can understand what areas are affected by the greatest imbalance. What do we need to focus on? Do we need correct hormones? We need to pay attention to mitochondria. Do we need to work on your gut, right? And then I have a kind of a proprietary panel of labs that I've developed over the years. Every patient gets this lab panel, but everyone's results are different. That's where the personalized component comes in. But how do you analyze that data? Well, I've done it for years manually. It takes me a long time, but now I can go through the raw labs, and I can then determine where the concerns are, if something's optimized, if something's low, if something's high, if something's in a significant deficit, a deficiency, et cetera, or toxicity. And then I can ask the AI to analyze it, and it does the same or perhaps better work, because it just brings a lot more clarity and detail in there in a fraction of time. Our approach is always food first. So my AI will then say, okay, based on these imbalances, here's some of the foods that I want you to focus on. Again, taken out of in this case, my second book, which is a food guide. And then finally, looking at the labs as well and where the targeted supplementation is needed. I use my line of supplements. I've taught the AI my supplements in a couple different ways. You can put in a URL so it can look at your website if you have a supplement website, or if you want to use another company's products. But I also have PDF handouts on all of my supplements. So I teach the AI about those supplements based on those PDFs. So now it can recommend targeted supplementation, the name of the product, the reason why, the exact dose, the target range we're aiming for, and tell that patient that, hey, in 3 or 4 months, we're going to be rechecking this and making sure that everything is optimized. So previously, each patient doing this manually might take me an hour. Now, 10 minutes at the very most. I still have to go back and look and see what the AI created, but it's still much faster. And as you know, we are working with Heads Up Health. So now we're taking our lab set, we're integrating it into a sort of an enterprise or customized version of Heads Up Health. So I will not have to manually analyze those labs. We've already indicated through the algorithm what is optimal, what is not optimal, what's high, what's low, what's toxic, what's deficient, et cetera, and what action steps I would typically take based on those results. So I'm looking forward to even more optimization, time saving, clarity for the patients. They can such a incredible visual to go on and what steps they need to take.
Yeah, and then hopefully, Dr. Charlyn, we can take it a few steps further and bring in some of the real-time data where the recommendations could also take into account the quality of the person's sleep, their rest and recovery. Are they getting into those deep stages of sleep? Or perhaps their CGM data that could give insights into their metabolic control. So that's where I think it starts to get more exciting when we start to get all of these pieces glued together.
Right. When we talk about, multi-domain, precision medicine, and we're having to consider lots of variables as human beings, it's very easy to, I forgot to ask that person about sleep apnea, or look at, their record and see if there are hints based on the medical history, based on the fact that they may be on more than one, 2 or more blood pressure medicines. And what I've said is, this is not only a gift, if you will, to the patients in terms of, helping them understand their own data, helping you as a clinician sift through that data. But if you have a lot of different services that you offer in your practice, the AI is a wonderful way to say, hey, by the way, there's been some very definite trends in nutrition and HRV and sleep patterns. Have you considered putting this patient on hormones? Have you considered referring this patient for a sleep study? Have you considered, and so on and so forth. So it actually allows you to maximize the services that you offer, benefiting the patients, benefiting you as a clinician, getting better data, whether you're using value-based care for reimbursement, or even if you're a direct pay model. In the end, we have to keep our doors open, and the more that we can do, engaging our patients in the services that we offer and improving their outcomes, in the end, the more money your practice is going to make too. So it's just a win-win all the way around.
Awesome. Thank you, Dr. Charlyn. And then the last thing we want to do is just remind everyone this doesn't have to be intimidating. There's easy ways to get started, even just getting a simple HIPAA-compliant version of an AI tool, or not, just even using the public one and not putting PHI in there, but just starting to learn how to prompt an LLM to get answers back to questions that you're looking for. Look up side effects on multiple medications. There's lots of easy, low-hanging fruit examples where you can start to get a feel for this. Find a few use cases that you can optimize for. Find one thing in the practice you can automate. Heads Up is also happy to help you get started. Find the first easy win that we can help you with, and then build on top of that first easy win. And then you can start to do more of the advanced things we've talked about, like getting the data connected and doing a lot more of the advanced use cases. So start with some easy wins, something you typically ask one of your assistants in the practice to do for you every single day that we could automate. So let's get an easy win and then build from there. So it doesn't have to be complicated. To Dr. Charlyn's point, he hasn't been an AI expert or done all these fancy certifications. He's just figured it out, tried different things, learns, made some mistakes, iterates, and now has become very successful at adopting a lot of these tools in practice. So as we come towards the end here, Dr. Charlyn, I think it's very exciting how you've pulled together different tools in the practice for different tasks. So I know you've got a couple tools you use for patient care. Can you just take us through quickly how you're using Claude and Gemini and Perplexity, and then we'll shift over to some of the content generation tools that you use?
Sure. In our practice, I would say in terms of a large language model, we primarily use Claude. It was introduced to me initially as the most scientifically based one, the most scientifically trained platform. Again, I do recommend not using the free versions. And there are many advantages once you pay at least the $20 a month level of these. So for the example I gave earlier, using the functional medicine timeline and matrix, I'm using Claude. I do use Gemini. I like Gemini's deep research in particular. We were talking yesterday, I've become quite enamored with Notebook LM, which can take either a variety of, say, articles that maybe you've pulled from Open Evidence or PubMed or what have you, and start to then synthesize this into not just one large document that really tells a story that you want to tell, but then Notebook LM can create mini podcasts. It has an audio version as well as a visual version. It's kind of like almost like a PowerPoint show with someone talking. Our patients want to be seen and heard, but if we built trust in them as the provider, as the physician, the other piece of it is if they know and feel that it's coming from us, it brings a higher level of authority. So it's even possible to take some of this data and use some of the more advanced AI tools, such as HeyGen, or some of the ones that just focus on the audio component only. These can learn your voice, your inflections, your hand gestures, if you will, your facial gestures, and you can create small video clips that say, hey, hey, Dave, I was looking at your Oura Ring data yesterday, and I happen to notice X, Y, and Z, and it's me talking to you for a few minutes, but it's all AI generated. And I think that we are a very visual learning culture, and some of even the handouts are wonderful, but we have to ask ourselves, are our patients going to read them, even if we put them at a level that the everyday person will understand? And I think when you start integrating some of these video tools and even ones that can highly personalize, it becomes an even more powerful tool. We use a lot of Gamma and Beautiful. I use Beautiful AI. My wife and the rest of my team use Gamma. We have webinars 3 or 4 days a week that are free to our functional medicine patients. My wife woke up this morning, I got to do my presentation. She asked me for something that I had done, looking at the relationship between balance and longevity, which was really just a deep research paper done with Gemini, as well as putting that in Notebook LM. But she was able to, within, I would say it takes Valerie about 30 minutes at the most, create PowerPoint slides that are quite lovely. She likes Gamma. Again, I've used Beautiful a little bit more, but they're both excellent, and have a presentation ready for our noon hour for our patients with very little effort. I give lots of talks in A4M and other places, and I'll tell you, I spend hours and hours and hours working on presentations, and it's remarkable that my team can put something together in 30 minutes that's very professional and very, very polished.
Awesome. Thank you, Dr. Charlyn. And you and I have been waxing philosophical as well about how we unlock more value from all of these sensors and wearables. And you've got a lot of insights into, you made the comment earlier, some of the more subtle signals in the data that may not jump off the page as quickly as some of the more obvious ones. So we're starting to now get to the point where we can unlock a lot more value from the sensor data. So I'd love to get your thoughts on how we can start to surface some of those insights. I know we've talked briefly about it on some of the slides, but I know this is also an area that you've done a lot of thinking on personally. You shared that paper with me with some of your thoughts. It was excellent. So how do you see the AI being able to help with some of the more nuanced data analysis? Because patients got all these, even an Aura ring, maybe measuring 20 or 30 different metrics, an Apple Watch, potentially hundreds of them, a CGM. It's just not scalable to look at this every single day on an individualized basis. So where do you see the opportunity in terms of analyzing the sensor data?
Yeah, I see it really at two levels. And practically speaking, the more folks that we put in the Heads Up Health dashboard, the more, in a way, challenges it creates because there's only so many hours in the day. There's only
Exactly.
the employees that you have that's going to be able to look at all that data.
Yep.
And it is a lot of data. So it is very doable, and the return on investment is incredibly huge. But the way to do it is to employ these AI agents. So I envision it more or less a human that is the head of a department, if you will, like a coaching department in your medical practice. That human has to oversee and sort of approve and problem solve what the agents are doing for you. But those agents can then analyze the data, identify trends and patterns, communicate with the individual patients in very folksy ways. You don't have to sound sterile and automated, like HAL and, 2001 Space Odyssey, right? I mean, you can definitely say, hey, Bob, I just noticed you weren't sleeping well this week, and I was concerned. I noticed your HRV was a little up. You doing okay? And depending on that response, we may have some steps that they may want to take and so forth. And again, the more we teach it, the more we automate it, the less in the end we have to necessarily worry about, am I creating more work for myself, which we certainly don't want to do. We want to make it easier. We create better outcomes for our patients, and we can turn around and because all of this is data driven, if you're in a fee-for-service healthcare model, you're setting yourself up for a perfect opportunity to shift to a value-based system where you can then turn to your payers and say, look, as a result of all of this, I'm getting way better patient outcomes, and I should be reimbursed at a higher level. And then, of course, also allows you potentially to see fewer patients and spend more time with each individual patient, which is what many of us really want to be able to do in healthcare today.
Awesome. Yeah. And just, from my own experience, Dr. Charlyn, having built this system and have seen all the different wearables and how they feed in, there's data points that are easy for us to identify at Heads Up. Like, hey, this person's gone 20% outside their baseline over the last 90 days. But there's data points that are harder, even for our traditional tools to pick up. Like, who's seen the highest increase over the last 5 years? Some of these changes are very, very subtle, and you just might not see it if you're just looking at day to day, week to week. Longer term trends that have been building over the course of years that we just don't have good tools to analyze today. Hypotheses about the data, we might ask, correlations between different metrics that we probably might not have looked at before because it was just too complicated to look at, for example, or we didn't have a software developer on staff who could crunch the data for us, which very few practices have. So I think there's just a lot more questions we can ask from the data, speculative or otherwise. I think there's a lot more signals we can train it to look for that we just haven't had the tools to look at before. And like you said, this is where we can start to really have an impact on value-based care and use the sensor data to its full potential.
And of course, there are specific types of sensors or monitors that are approved through the FDA where you can do remote therapeutic monitoring and bill for
Correct.
that.
Yep.
There are opportunities, again, once you've amassed enough outcome data and other important data points, which that's probably a separate discussion, what you need to bargain, if you will, for value-based care reimbursement, or if you have a purely cash-based direct pay model, just integrate the cost of a Heads Up Health platform, into the cost of your membership or your, how you sell your packages and so forth. And when it's spread out over a number of patients, really the cost is extremely minimal, but the return is quite remarkable.
You've got a talk coming up at A4M, Dr. Charlyn, if you want to share a bit about that. I know you just launched your podcast, and your website is at functionalmedicine.doctor. What would you want to leave us with, Dr. Charlyn, if people are listening here and they've got additional questions for you or potentially patients, referrals, et cetera?
Yeah, well, I'm very blessed to be a regular speaker for the Academy of Anti-Aging Medicine. I'll be speaking a couple of times at A4M, one in the what they call the big show, the main stage, talking about some of the most exciting things happening in brain health and regenerative medicine that have happened in the last year and where things are going. We're going to be talking a lot about brain span, not just lifespan. I did just
That's a new term. I like that one.
Yeah, 'cause that's what we really want, right? You can live
Yes,
to
we need the cognitive facilities.
That's right. So, but I do teach in their fellowship program as well. So practitioners are looking for practical knowledge, certification, things like that. I highly recommend A4M. Please do check out the podcast, and that is my clinic website. There are opportunities if you want to get involved with our clinic to schedule a complimentary phone call where we get to learn about you and we want to help you out and make sure it's also going to be a good fit. So there's lots of content out there. And of course, I'm on all the social media channels as well.
Awesome. So we've got one more question here based on everything you have heard today. We'd like to know if we've piqued your curiosity in any specific area. So I'll go ahead and fire up our second question here. And last but not least is if we've piqued your curiosity here today about what's possible with AI, we'd love to schedule a discovery call with you. And we'd like to learn a bit about your business. We'd like to answer some of your questions about how AI can be helpful for you in practice. So if this is something you want to get started on, just go ahead and schedule a discovery call with us. We're happy to share our expertise with you and suggest ways that we can bring a lot of this technology into the practice, how you can make sure it's done properly, securely, how we can start to automate some of the workflows and give you some of the time back, start to unlock more value from the data in the practice. So if you've got questions and you want to learn more, go ahead and schedule a discovery call with us. And with that, I just want to say a huge thank you to Dr. Charlyn for sharing your expertise with us. All the examples, Dr. Charlyn, of how you're starting to figure out how to put these tools together. I just love the example you gave when we were prepping about the word doctor as educator. And that was just beautiful. And the way you can take some of these complex topics and make a easy to understand video for a patient that they're more inclined to engage with than a lengthy document, for example. So just the way you're starting to think about how you can use the technology to make the work you're doing relatable, to unlock more value from the data you're capturing. You've just taken a really broad and creative, I think is the best word that comes to mind, creative approach on how you're doing this, from the way you're creating the webinars with Valerie, analyzing the HRV data, making these really patient-friendly tools to understand how you can help them on their journey. I think it's just awesome. So thank you for sharing all of that with us.
Pleasure. Thank you.
And Tom and Angela and everyone who supports the webinar here on our team, thank you. And we'll be following up with the replay for those who missed it. We'll also do a recap on all the questions that we couldn't get to in the Q&A, so we make sure we answer everything for you. And thank you for taking time out of your day. And we'll sign off now. Thanks, everyone. Have a wonderful day.
Thanks, Dave.